Hi, everybody. I'm glad you guys can join us for another great edition of the Women's Health and Wellness Initiative and the Institute. I'm Leanne Suter. I'm a reporter at ABC7, and I'm filling in today for the amazing Dr. Tiffany Grunwald. And we are going to be talking with Dr. Claudia Sanmiguel, but I want to tell you a little bit, something that you guys already know, that the Women's Health and Wellness Institute at St. John's is focused on providing the full spectrum of women's healthcare across the continuum of their lives. And the biggest goal there is really about education. And that's really kind of why they've started these conversations to talk about all kinds of topics and really be able to answer so many questions that women have about what is happening with their health, with their lives. And the doctors that we've been having on every week have been so fascinating, and you learn so much from them. So I want to tell you, if you have any questions, put them into the chat box on Zoom, or you can put them in the comment section on Facebook Live, and that's how we'll be able to get to them and be able to answer some of your questions. And we usually explain a little bit about what's going on. Today we're going to talk with Claudia Sanmiguel. As I said, she's a gastroenterologist, but I want to mention, so you can plan ahead for next week, that we will be talking with Kimberly Childers. She is a genetic counselor at St. John's, and she's going to talk about genetic testing and kind of how they decide who needs genetic testing, what kind of testing to do, and how that decision is made and what's involved in that process. So that'll be pretty interesting. But tonight, let's focus on the amazing Dr. Claudia Sanmiguel. She is a gastroenterologist. Thanks for joining us. Dr. Sanmiguel, tell us a little bit about kind of what you do and why you chose gastroenterology.
So I'm a gastroenterologist, and I have an interest in GI motility, meaning how the GI tract works, moving the food down to the stomach, from the stomach to the bowels and out, and also in how the brain connects to the gut and how it interacts with the microbiome, meaning the bacteria that lives inside of us. So those are kind of my interests in research and in practice. I practice general GI and motility. Most of my practice is with patients that are women. And I'm happy because I think sometimes women feel a little more comfortable to talk about some topics with other women. And I can relate to some of the stress and issues that they have. I'm from Colombia, and I'm trained in gastroenterology actually twice, initially in my country, in Colombia, and then I came to UCLA and trained in GI. I had done research at the Cleveland Clinic in Ohio, in Canada, and also at Cedars-Sinai. So I had the opportunity to work with Dr. Mark Pimentel. I had in Cedars-Sinai and with Dr. Maya in UCLA for the brain gut access. And why GI? Because it's fascinating, meaning there are so many things that you can learn about how your body processes food, how the nutrients are taken into your system, and how your system regulates that, and how the environment and how your body responds to the environment can change how your digestion works. And also, I like to do procedures. So I do endoscopies, colonoscopies, manometry. So you see kind of quick, easy fixes sometimes, and you can change the life of somebody with little things done at the right time.
And you mentioned wanting to focus on women. So let's talk about women's health and dealing with GI issues. Stress, we know, is a huge factor in many women's lives, especially since they're usually taking care of more than just themselves. There are a lot of other people they're taking care of. How much of an impact does that have on their gut health?
Well, it is a very important factor in how our GI system works. And there are two classes of stress. you have good stress and bad stress. So the good stress usually is short duration, and it just helps us to cope with things and kind of react quickly. And for example, you get stress out with
Oh,
too long.
just make that into your dinner.
I'm going to jump in real quick and interrupt you. Anybody that's listening, if you guys can hit mute on your microphone, that would be great. That way we doesn't distract from this. And then when you have a question, just remember to type it into the box. But continue, Dr. Sanmiguel.
Okay, so I was saying that there is good stress and bad stress. Usually the good stress is the one that we have prior test, and we are all excited, and we learn whatever we need to learn really quick, and we respond, or something that just changed our life, and we respond and we cope with this. But there is a chronic stress that comes from environmental, emotional, and even dietary issues. Like if you are taking care of somebody, if your boss is being not very nice to you, if now you have to try to help your children to learn things that you didn't have that responsibility before. So that activates changes in how your brain manage your gut. And remember, your brain is connected to your gut directly. And the brain is sending information all day long to your gut, and your gut is sending information back to your brain. And basically, the gut is telling you, I'm full, I'm hungry, I'm bloated, I'm having pain, I just ate. So it's a lot of information going on. But when your brain is all the time activated and it's a big computer getting all this information, it's also sending information down, and it's telling, oh, I'm stressed out, so stop digesting that food. We cannot go to the bathroom now. So it changes how your gut goes. We know, for example, that when you are stressed out, many people get diarrhea, other people get constipation. People can get gastric ulcers because how the brain is connecting to your gut, it changes some of the protective mechanisms in your gut, like the mucus layer that protects your stomach so the acid doesn't cause problems, the blood flow into your digestive system that allows you to process the food and absorb the food. So it has a real impact. And there is another kind of stress, and maybe I'm talking too much, but it's dietary stress. And it's whatever we put in our mouths is going to affect the environment inside of us. So if we are stressing our system with a lot of processed food that has a lot of chemicals that we are not designed to process, then we are putting stress on our body. And actually the microbiome or the bacteria that lives inside of us has to adapt to the new chemicals that they were not expecting, and they start to process, they take advantage. And sometimes the communication that go from your bacteria to your gut cause damage instead of being beneficial, that it could be too. Remember, the bacteria in our gut give us vitamins, it gives us some energy that we need. It protects our gut and makes it better, like healthier mucosa. So if we mess with that, we mess with our health.
And microbiome has become such a focus these days, now that you guys are learning really how connected the brain is to our gut and that microbiome. I know they're really looking at how that is even maybe connected to cancer and so many other things. But let's talk about how important it is. IBS is something so many women deal with. Is stress what causes IBS, and kind of what can we do about it?
Okay, so I will say that it depends on the person. I have patients that tells me, I had diarrhea, abdominal pain, I'm bloated, but when I go to vacation, everything goes away. I'm distracted and relaxed, I forget about the world, and I don't have symptoms. And right when I come back to my work, I have again all the symptoms. So that person is coping with the stress through the GI system and disorganizing the function of the GI system. And once that stress, emotional stress goes away, then the person feels better. While there are other people that say, you know, I practice yoga, meditation, I have a clean diet, and still I have symptoms. What is happening? So there is a subgroup of patients that stress is not the only trigger for the symptoms. It is just something that can worsen the symptoms, but it's not the only trigger. And in those persons, you have to also think, maybe they have something else. What if they have pelvic floor dysfunction and that's why they are constipated? It's not because IBS only, although they can have IBS, the pelvic floor dysfunction, meaning how you manage all your muscles to have a bowel movement is not well coordinated, and then you have more constipation. Or people with diarrhea, what if you have celiac disease? Or what if you have microscopic colitis? That is a inflammation of the colon that is mostly in people over 50 years old. Or what if the supplement that you are having has a lot of fermentable sugars that is just causing a lot of symptoms? So you have to see the person as a whole and not just as a GI system to figure out what are the triggers for the symptoms, what can be happening in this person. So stress, yes, can trigger symptoms and is the main driver in some people. In other people, it plays a role, but it's not the main driver.
You touched on one thing. A lot of people hear IBS and maybe make the assumption, is that the same thing as Crohn's or colitis or some of the other diseases we hear about? Is it the same thing?
No, it is not. So inflammatory bowel disease or Crohn's or ulcerative colitis is when your body gets confused and it starts to attack the lining of your gut. And it produces inflammation, ulceration, and it's an immune disorder per se. So that is different from IBS, that there is not this immune response attacking to your bowel. I should say, though, that people that have had significant inflammation in their bowel, it changes the microbiome and it changes how the gut moves. So they can develop IBS after having colitis or even a really bad food poisoning with gastroenteritis. You can develop IBS after that. But IBS is not that colitis, it's a consequence of that.
Got it. And is IBS something that can be cured, or is it something you manage?
It depends also on the people. It depends what are the triggers and how you can cope with it and how you can change those triggers. So as I told you, I had patients that just have symptoms when they are during the weekdays or when they are working. So if they learn how to cope with that stress and not send it into the GI tract and just let it go out doing exercise, relaxation, bettering their diets, don't taking the things so strong into them, don't put too much pressure on themselves, those people can really get rid of the symptoms easily. Other people that had less of a stress component or emotional component, they might be able to manage the symptoms. And I would say that some people actually get cured, especially in people that have a post-inflammation. So I have many patients that had IBS that started 2 or 3 years after a food poisoning, and then they slowly get better and better and they get out of the symptoms. other thing that is important is anxiety. If you can manage the anxiety, the symptoms of the IBS improve significantly. If you have better diet, if you do exercise, if you take care of yourself as a whole person and not just think about your GI tract, that helps you to actually get rid of the IBS if you can, or at least have a way better quality of life.
You mentioned one thing that where these food poisoning, things that can trigger IBS, that can cause it. It just made me think, quick question, COVID. We're hearing so much about COVID now that's triggering GI issues. Are you finding that that's the case now with people that have had it?
Yeah, it is the case, but really we don't have experience. We are hearing from people, yes, I'm having more diarrhea. And I have a patient, for example, that had really bad COVID. She wasn't in the ICU, thanks God, but she was almost right there. And there was diarrhea forever. And you can say, well, she was in antibiotics, she was hypoxemic. Maybe those things contributed to change a lot of GI function, but it has been months and months after that, and she continues to have that, and now she flipped to the other side. Now she has constipation. So your GI tract is just trying to get back to the normal, and it's kind of disorganized. How long this is going to last, we don't know, but we try to kind of, from what we have learned from functional disorders, try to help the people to try to recover faster and hopefully don't have long-standing symptoms.
It sounds good. I know so much is not known. I'm going to throw it out there again. Anybody listening or popping in, put in any questions, anything you guys want to know about, type it in the chat box on Zoom or on Facebook Live. You can put it in there. We'll make sure that we ask Dr. Sanmiguel. Let's talk about some of the things, symptoms or things we can find. What about blood in the stool? Is that a part of IBS?
That is a really important question because many people have blood in the stool and they don't want to go to the doctor because of that. And they say, oh, well, I have IBS long time, so it might be. So no, blood in the stool is not a symptom of IBS. So that is not. However, I should say, if IBS is giving you diarrhea and you are running to the bathroom 10 times a day, your hemorrhoids can get irritated and then you can bleed from your hemorrhoids. But that is kind of different. It's usually bleed that goes into the toilet or when you wipe and you see it in the paper and you have like the discomfort in the anal region. Or the same with people with constipation, hemorrhoids can bleed. So, but if you have bloody diarrhea or it is not kind of the typical, we are all mandated to look and try to figure out why is the bleeding. I had recently, less than 2 months ago, a young patient that he was having a little bit of bleeding and everybody said, oh, goodness, that is just hemorrhoids. Don't worry, they will go away. And he didn't have any other symptoms. And he came to me because, you know, I'm feeling kind of tired now. I'm bleeding. I'm tired of this. Let's find out. And when I checked his labs, he had a little bit of anemia. He looked good, but I said, you know, let's do a colonoscopy, make sure what we're looking at. And he was 40, and I found cancer in the rectum. So, and I had also a patient, 29. She had a polyp right there in the rectum and it was bleeding and looked like hemorrhoids. I thought I will find hemorrhoids. And no, she had a polyp right there in the rectum that when the stool was coming out, it was crashing into it and bleeding from that. So no, blood is not a symptom of IBS.
Got it. Let's talk about some of the things maybe we can do. I know a lot of people talk about cutting out dairy and gluten to get rid of IBS. And I mean, they also talk about it, I know, with Sibo. Does that really help in any of this?
So celiac disease exists, but it's not everybody. It's a low percentage depending on the population. So if you do have celiac disease, changing your diet and taking out gluten is going to improve either constipation, diarrhea, or bloating, because celiac can go either way. So you should be tested for celiac. So, gluten intolerance is more difficult to really figure out because we don't have any marker for gluten intolerance. We just have how the patient feels before they took the gluten out of the diet and how they feel after. So it might be that some people, not because they are gluten intolerant, because something on the diet might change how the microbiome digests. And maybe it's the gluten, maybe it's not, but it might help. But gluten, like gluten-free diets, I have many patients that had it and they have been 20 years without eating gluten and still they have IBS symptoms. So gluten is not the cause of IBS. Lactose, we all love ice cream, milk, cheese, because it's delicious. What can we do? But we are not designed for having milk all our lives. So we are going to lose the ability to process milk. So people will lose it sooner and they will be very reactive because when you don't digest milk, your bacteria love that and digest it and make a lot of gas, and then you're going to have diarrhea and gas. Other people have very minor symptoms. So you have to figure out if you have it, if you want to deal with the symptoms from time to time when you have your ice cream, or it's something that you don't want to deal with that, and too sad, milk is out of my system. But milk lactose intolerance is not IBS. Some people are confusing IBS with lactose intolerance. So if you had that doubt, there are tests that are designed to know if you do have it or not.
We have one question which makes sense, and we should have talked about this at the beginning, but we talk about women being under stress, but is IBS more prevalent in women? Is this something you see more in women than men?
It is, and we don't know exactly why. Some people say it's because women are more in tune with their bodies and they feel that something is wrong, and then they go to the physician and talk about it. The men are a little more like, whatever, if I'm gassy, I'm gassy, so that's the problem. But we don't know why. But yes, in our studies, in population, women have more IBS than men. And we have hormones, we have different microbiome, we have culturally different roles, and we deal with the stress in a different way. So that could be all part of why we at least complain more frequently about IBS symptoms.
We have somebody asking, Doctor, about Sibo, wanting to talk a little bit about the impact and what can you expect, from an antibiotic treatment?
Okay, so Sibo has been present as a diagnosis for many years, only more recently with Dr. Pimentel and other doctors, Dr. Shea, it has been placed in a more important role in IBS or in GI symptoms. Sibo is not the same as IBS, but many people that had IBS had Sibo. Not all the people that had Sibo has IBS. Sibo per se usually don't give you much abdominal pain, and abdominal pain is kind of the cardinal symptoms of IBS. Usually Sibo is more bloating, flatulence, diarrhea. In some people actually can cause vitamin deficiencies. And basically Sibo is when bacteria starts to grow in the small bowel. The small bowel it connects the stomach to the colon and usually have very little amount of bacteria. And usually the bacteria is what we call gram-positive, meaning they are more kind of similar to what we have in our mouth. The colon has more gram-negative, it's a tincture that we use to identify the bacteria. and they tend to produce more gas and ferment fiber and other things. So Sibo is one. There is more bacteria than usual in the small bowel, and usually that bacteria is more similar or is the same bacteria that you have in your colon. So it's actually not bad bacteria, but in the wrong place. And that is the diagnosis of Sibo. And Sibo is diagnosed either because we take samples of that juice in the small bowel and we can see that there is more bacteria, or we do breath tests to see some of the products of that bacteria. So when the bacteria ferments fiber or sugars, they produce gas, and that gas comes out the normal way, but a little part of it comes out in your breath. So we can actually do tests measuring those gases in your breath and say this person has Sibo or it does not. The tests are not perfect. They are not 100%. So some people can have Sibo and the test is negative. And some people can have Sibo by the test and do not have symptoms. So we don't know exactly how to diagnose it, but when you have all the symptoms and the positive test, you have a kind of a clear picture that this is probably the cause of the symptoms. Then we had to treat, and the usual treatment, and this has been empiric, is bacteria that is not in the right place, we should kill it with antibiotics. So we do antibiotics. What antibiotics for how long has been controversial, and still we are going on in several trials trying to figure out what is better. So far, the one that we are using the most is Lyfaxamine, just because it is not absorbable, so it has less systemic effects than other antibiotics that actually kill the bacteria in your gut, but actually affects other bacteria in your body and can have side effects because it's absorbed. The issue with antibiotics is that you can have side effects. You can have C. diff colitis. You can have allergic reactions. So let's say that our current approach is antibiotics. Many people with antibiotics, and many people meaning 40 to 70% get better with antibiotics. Not everybody gets with antibiotics. Some people get better, and we test again for Sibo and still have Sibo. So it's maybe other bacteria that is living with this bacteria that produce the gas. Other people, we eradicate the bacteria, the Sibo test is negative, and they still have symptoms. So it's not 100%. It's not like, oh, I have Sibo, take antibiotics, I'm going to be fine.
Yeah, not a clear-cut answer. What do people that say that there's a lot of talk about probiotics? Would that be the other option? Can probiotics solve Sibo or even solve, IBS?
Our scientific studies control and everything. And remember, probiotics is a difficult thing because there are many probiotics, and the amount, how they put the bacteria together is different in different products. So it's very difficult to compare one to another. There are studies that show that Sibo may be improved by certain probiotics, and they think it's because the bacteria that we are giving in the probiotic can compete with the bacteria living in your small bowel and give you some relief, or the bacteria. So when we have Sibo, usually is that the sweeping mechanism that cleans your small bowel is not working fine. So we think that we give a probiotic that stimulates those contractions and it cleans better your small bowel, it can help. But we also know that many people take probiotics and they start to get bloated. So probiotics could cause Sibo. And there is a recent study by Dr. Satish Rao that is in Georgia. He's a great GI doctor, very sound scientist. And he started to notice that some people with SIBO were getting probiotics and a specific type of probiotics that contains lactobacillus, that is usually what we take as a probiotic. And these people start to have fogginess, brain changes, cognitive changes. And he did a study and measured what was happening in these people, and they have something that is called the lactic acid. And he gave antibiotics, got rid of the probiotics, got rid of the bacteria measured by Sibo blood test, and the fogginess went away. So not always probiotics are good. It's a small study, but it raises a lot of questions. And it will make us a little more careful about when we take over-the-counter things without even knowing what is in there.
That's one of the questions we have, though. Is there any natural or alternative approach to dealing with SIBO instead of just antibiotics? Is there anything that you're seeing is working?
So there is no conclusive data for SIBO in herbals or in probiotics or in alternative medicine. However, there are things that you can do to help to decrease the recurrence if you take antibiotics and you don't want to have to take again antibiotics. There are a few things that you can do. So one of the things that is very important is to help your gut to clean itself. So that means that you need to have something that we call the migrating model complex. That happens when you are not eating, when you are fasting, and that you have to wait at least 3 hours, 4 hours after a meal. So the process starts, the process is 90 minutes, but the migrating model complex is just 5 minutes at the end of the 90 minutes. So you have to be 4 to 5 hours without eating to allow this sweeping. So this actually contracts from the stomach or duodenum, and it goes all the way to your colon. So it cleanses everything. So it's a big contraction going on. And also pancreatic enzymes that are going to digest the food that is there and also kill bacteria. And all that go in a rapid movement into the bowel. So we believe that that is actually going to prevent for you to have bacteria living in the wrong places. So basically, prolonged fasting helps. So that intermittent fasting can help for this. If you are not diabetic and have to be eating, you should be having some prolonged period of fasting. And remember, if you go to sleep, you don't finish your digestion. So go and eat and go to bed, you don't finish your digestion, you are just giving food to the bacteria that lives in the wrong places because it's not fully digested. So prolonged fasting, don't go to bed with a full stomach. Walk, exercise helps actually to make the things move more efficient in your GI gut, especially people that have constipation. Other things, do not, if possible, take narcotics or pill medicines for pain, because narcotics actually decrease the contractions and the sweeping mechanisms of your bowel and disorganize the contractions. So actually people in narcotics can have more SIBO than people that is not in narcotics. If possible, and you don't need it, try not to take high doses of acid suppressant medications because acid kills bacteria. So it helps to keep your GI tract normal. Some things that are out there but not quite proven is use bitters or ginger just to stimulate the contractions in your bowel and clean that. So ginger tea, bitters, yeah, basically that. What else I can think of? Oh, avoid taking probiotics just randomly. When you want to be selective what probiotics and for what you are taking it. There is no evidence of taking probiotics in general helps your general health. It has to be a little more specific.
And speaking of that, is there anything you can give us some of the names? I know they have very big, long names for the probiotics. Is there one that you guys do know might have some more evidence behind it that it could work?
So it is different for different people. I will say that it's better when you have a probiotic prebiotic combination for most of the things, because really then the bacteria will stick around, because when you take probiotic, it goes out right away. So you have to keep taking probiotics. When you take prebiotics, the bacteria that you are taking is helping to keep the environment and that bacteria alive, and you are feeding also your normal bacteria. But there is controversy because some people think that some prebiotics can work once you take your Sibo antibiotic treatment. Some people feel that giving prebiotics can seed again that area, but there is no studies really for that. I would say that it's better to take fermented foods if you can tolerate it than actually buy bottles of probiotics.
I was just going to jump in. Let's talk food. Let's talk the prebiotic that you're talking about. Are you talking about things like kefir? We hear about kimchi, sauerkraut. Is that kind of what we're talking about? Fermented food in that way?
Yeah, so all pickled food, yogurt like kefir, that is not, the bacteria is not processed or killed. But prebiotics are also prebiotic is something that gives food to the bacteria. So anything that has fermentable fiber can act as a prebiotic. So kefir and fermented food are probiotics. So they had the two components. They had the food and they had the bacteria. The prebiotic percent is just the food for the bacteria. So you can have, like there is a recent study that shows that the fiber in kiwi is excellent for constipation. So have kiwis. If you can tolerate that prunes and raisins actually are pretty good to stimulate your GI tract. The problem is that they have sugar, so if you are diabetic, that is kind of not a good thing. And some people get gassy with that because you are feeding the bacteria is happy and producing gas.
Got it. I want to touch, people had asked, you mentioned ginger tea, and Dr. Sanmiguel was talking about bitters, the ginger tea and bitters. And bitters, I don't know much about, but is it generally a tonic they can take, or is that a bitters tea as well, doctor?
So you can find it in different forms. There are people that just eat it as a leafy things, that there are combinations of I'm just blacking out the name. So arugula, and there are there are like herbs that actually they are called bitters. In Europe, they have something that is called Iberogast. That is a combination of bitter herbs. And Germans also have another combination. So there are there are different kind of combinations of bitters that they use as a digestives, and you can find it like in little bottles. The only problem is that most of those are combined with alcohol, so you have to be a little careful about that. Even Iberogast that is sold as a medication, it has alcohol.
And one other thing, you talked about fermented foods. Somebody had asked, is such a thing as having too much fermented foods? I'm going to guess that that's probably not true. Oh, that is true. I was thinking of other countries where that's all they eat is fermented food and they don't have, but they're wondering if you have too much fermented food, could that cause stomach cancer? Or
no, stomach cancer, no. So these are not associated with the stomach cancer. What is associated with the stomach cancer is a bacteria called H. pylori, and also exposure to nitrogen products in the water or in roots, like similar to potatoes, different kinds of roots that can concentrate depending on where they are being growth. Nitrate products there, and some people that had very low production of acid in the stomach, actually they can develop gastric cancer. Taking too much of fermented food can give you gas actually too, because there is bacteria that is fermenting things. So you put then a lot of them, you can have a lot of gas too. And some people find that they can have high contents of histamine. That is amino acid that can give you kind of fogginess, abdominal pain, things like that. So you have to be careful when you consume those. You cannot just, as always in life, always with moderation.
It's always such a puzzle to figure out what does and doesn't work for you, especially when it comes to issues with your microbiome, as we're learning. And it's really a complicated system.
Yeah, and actually you have to take into account that not everybody responds the same to the same treatments, because their microbiome is different, because how they cope with symptoms and how the digestive system works is different. So the thing that works for your uncle or for your aunt or for your sister might not work for you. Or especially if you are not related, whatever it was for your friend, it doesn't mean that it's going to work for you.
And somebody also asked how long Kiefer's probiotic is still active after you open the container. Does it die with
you have to ask the manufacturer, because that I don't know, because you know, if changes in temperature can change that, or that food can get spoiled, because then you can have too much bacteria going on. So you have to be very careful how you manage that. Too much is too much.
And one other quick question about diet. They were talking about celiac disease. And should people strictly follow a gluten-free diet with celiac disease? And if they don't, what can happen?
So if you have a clear diagnosis of celiac disease, meaning that you had the antibodies measured in your blood, and they did an endoscopy and took samples of your small bowel, and they saw that the lining of your small bowel was affected by the celiac and it was damaged by the celiac, yes, you do have to be strict in your diet. Although there is some medications that now are being studied to try to help the people, they are not mainstream yet, they are just under research. So there is hope that in the future, if you get accidentally exposed to gluten, you can have something to kind of diminish the symptoms. There are people that have very mild symptoms with gluten, and those from time, once everything is healed, they sometimes use gluten for a little cracker or a little piece of cake, and they don't develop any symptoms, but they have to keep the gluten-free, because when it becomes like everyday exposure is when the antibodies get activated again, and then you can have the damage of the mucosa, the bloating, diarrhea, and many people say they get headaches, depression, mood changes, and a lot of other symptoms with celiac.
So obviously, if you have a confirmed case of celiac, gluten-free diet obviously is the best thing for you. There was somebody here who was just asking, if a person has asymptomatic celiac, do they still have to follow it when it comes to cross-contamination? But again, you're just saying that it's best just to avoid it.
Yeah, so basically, I wonder how it was diagnosed. So you had to be very careful with the diagnosis of celiac. You had to see what antibodies were measured, and it really there was some damage in the mucosa. Sometimes people get just genetic testing for celiac, and they think that they have celiac, but really they are not expressing that gene. So the gene can exist without being turned on and start to cause the disease. So you have to figure out how it was diagnosed, and then you can talk. So it's better to talk to your physician before you do any risky stuff.
Got it. She's saying she was tested with a blood test and had cross-contamination from a toaster, which, so I'm sure that is tough. I want to go back to IBS and Sibo just to confirm. The best way to manage it then, are you saying, is with diet?
No, diet hasn't been that successful to manage Sibo, and I know there are many diets out there, low fermentation diets like the low Fodmaps or the sequential Sibo diets, and there are some really dangerous diets that basically are designed supposedly to cause starvation of the bacteria and kill the bacteria of hunger. That doesn't happen because the bacteria had a lot of tools that when you don't give them fiber, they start to process other things that you don't usually process. It's when you are hungry, everything looks good. If you are not hungry, you are more selective in what you are going to digest. But when the bacteria needs energy, they will use anything that you put. So even if you try to cause starvation to the bacteria in the Sibo, you are not going to.
So it sounds like it's pretty tough. A lot of people are asking, what can they do to minimize then the reoccurrence with IBS and Sibo? Is there something that they could eat that could help in the process?
I think we already talked about that the intermittent fasting might help with the Sibo. With the IBS, it's mostly, so when you have significant symptoms of IBS, it doesn't matter what you eat, you are going to develop symptoms. And it's not what you put in your mouth, it's just how your body is reacting to the stimulus of having food inside. So you have to be always trying to be healthy. So the less stress that you're putting in your GI tract with chemicals, processed food, and things that shouldn't be there, the better that your GI system is going to be. The low Fodmap diet it works for some people for IBS, and it's people that had a lot of strong will, because it's not easy to have this diet because it just gives you very limited things that you can eat. So, and also it decreases a lot of sources of good fiber. So I will say that low Fodmap diet, if you respond to it and you can keep it, good for you. But most of the people cannot keep that diet. So you have to get into a balance of exercise, manage the stress, treat the things that we can treat. If you have neuropathy, dysmotility, some of the things we can help with that with some medications. And just take care of yourself as a whole thing, not just on the symptom. Don't focus just in the symptom, just have a global vision of yourself.
Yeah, the low Fodmap diet is very tough and very restrictive, as a lot of people know. One person is asking a really good question, I think. When it comes to menopause, how does that change kind of our microbiome? And does that often mean we end up with these symptoms of IBS and SIBO because of menopause?
We know that actually it does, and it was amazing to me. So when I was doing research in microbiome and got brain microbiome interactions, I started to review a lot of research that other people has done, and the microbiome of men and women are different. And the microbiome of women before having menstrual periods and after and during having the menstrual periods and after, it changes too. And it's not humongous changes, but it seems that it's significant enough that you can have some symptoms. We do know that elderly people have more tendency to have a sluggish GI tract. It becomes, you have more constipation, or you react more badly to any stimuli. You become more gassy, and actually some people actually develop SIBO when they become elderly, or because this motility changes. So yes, menopause and old age changes your microbiome and changes your GI tract.
More good news for us as we
No, you actually can do things. You can move around, you can have healthy diet. There are many studies about the people that are living up to 100 years or beyond that. And the things that actually seem to be markers of good health is moving around, not going to the gym, is just walking to the grocery shop every day, do gardening, move, go for walks with your friends, connect with your friends, having healthy products, not too much processed food. All those things together help people in Japan, people in Latin America, people in Italy that are totally different diets to live longer. So it's not only the things that you put in your mouth and your digestive system, it's how you live your life. You are all day sitting down, your GI tract is going to be more sluggish, the bacteria is going to have more time to ferment and produce more gas. So you have to be wholly healthy.
holistic, very whole approach. But as you said, science is showing really the mind-gut connection is so strong. You guys are really finding that in evidence, I know. I was going to talk real quickly. Is there hope? Like once you're diagnosed with SIBO, or once you get the symptoms of IBS, is there hope that you will be able to resolve it and it will go away one day? Or is this something you kind of need to learn to work with for the rest of your life?
So I will say that about, in my experience, and can be different from other people's experiences, because it depends the kind of patient that it get into your practice. So I have experience with people with horrible IBS, because I'm a GI doctor in motility, and I would say that those people with horrible IBS, once I rule out other things like microscopic colitis, celiac, pelvic floor dysfunction, other things that may be worsening the IBS symptoms, then those people have less chances of get rid of. If you have something concomitant and we can treat that, your quality of life improves significantly, and actually you can manage your symptoms with getting off medications and only treating the flares. young people with post-infection IBS or people that are very stress responsive, but they can manage the stress, they usually don't need medication all their lives. From time to time, they will have a flare and we have to manage that. Sometimes the flares are just one day and they're fine, so they don't have that. So there is a spectrum, and you have always to try to get better. You don't have to live with the symptoms.
Somebody's asking the same question again, kind of about food, especially with Sibo, but I know there isn't one thing that you should eat, one thing you shouldn't eat. I know it's very different. You were just talking about for different people. The Fodmap's diet, which is very tough, but that seems to help if you're able to follow it. Does it seem like a lot of the, no?
The majority of the studies show that actually it does not help Sibo. And it doesn't get rid of the Sibo. Many people have done the low Fodmap diet and they haven't cleared the Sibo. Other people actually had done the low Fodmap diet and the gas production decreased significantly because you are not having any things that are going to be fermented into the gas, but the people keep having symptoms. So is it that they have IBS on top of the Sibo and it's not going to respond to that? Or is that the bacteria that is causing the Sibo is a different bacteria that we don't know how to test for right now?
I just want to run through, we have just a couple of minutes left, but I want to run through some of the things that you said that you are learning that are working. And just to put it in simple terms, intermittent fasting, you guys are learning a lot about that. Trying to get people not to eat, if I have this correctly, generally try to not eat 2 to 3 hours before bed. Don't eat obviously through the night. And again, if you can give it a little bit of a window in the morning, maybe push it until 10 o'clock in the morning or something. Would that be good intermittent fasting?
Yeah, so basically you don't want to eat anything too close to the time of to go to bed. And if you can have at least 9 hours of non-eating anything, hopefully 12 if you can, is even better. But some people can do longer, but usually it doesn't make that much of a difference to have even longer that. So I would say 9 to 12 hours should be kind of the goal. And and that includes little snacks. You cannot have a cracker in the middle of the night or anything like that. So it's not eating.
It is not eating. I also want to say it also means no drinking. I know that even fruit juice, orange juice is counted in that because that has the sugar of food. It's nothing but water and tea from what I understand.
Exactly. And the other thing is, remember, sugar replacements are bad for fermentation. They cause a lot of gas, they cause a lot of metabolic things. So you have to be mindful of what you put in your tea, coffee, the creamers, all those things. Get rid of those.
That sounds good. Dr. Sanmiguel, you have been great. Thank you for answering all these questions. And just to wrap up what you said, consider intermittent fasting from 9 to 12 hours. 12 hours max would be plenty, but that would be good. That means nothing going in your mouth other than water and some clear liquids. But and really try with the mind-gut connection. Really try to reduce that stress, maybe some meditation, go for a walk, and really try to keep that microbiome, your gut, happy.
Okay, that's good.
Thank you so much, you guys. It was fascinating, great to learn all of this, and hopefully we will all have happy bellies soon.
Bye-bye.
Thanks, guys.